Today, we're diving into a medical treatment that's been a staple in intensive care for decades. It's simple, it's common, but there's this huge question mark hanging over it. Does it actually work? Or have doctors been getting it wrong in this whole time? So, what are we talking about? It's a basic sodium bicarbonate IV drip. And the condition it's used for? A really dangerous buildup of acid in the blood that can basically send the whole body into a catastrophic spiral. For years, the logic made perfect sense. If the body's too acidic, just add a base to balance things out. But as we see all the time in medicine, what seems logical isn't always true. Okay, so let's get into it. To really understand this whole controversy, we first have to understand the problem that doctors are trying to solve. And it all boils down to this incredibly delicate chemical balance that is literally essential for us to live. The condition is called severe metabolic acidemia. And a good way to think about it is to picture your blood like a swimming pool. It needs to have its pH level in that perfect zone. If it gets too acidic, dropping to a pH of 7.20 or even lower, all the vital machinery in your body just starts to shut down. And when I say shut down, I mean it in the most serious way possible. Your heart can't pump right, your blood vessels get too wide, and your blood pressure just plummets. Your kidneys start to fail, even the muscles you need to breathe can get weaker. This is a full-blown, life-threatening emergency. So you'd think with stakes this high, the go-to treatment would be backed by rock-solid evidence, right? Well, for the longest time, it just wasn't. That all started to change back in 2018 with the first really big trial that tried to tackle this question head-on. For years, doctors were really in a tough spot. There was, as the original paper put it, an absence of high-level evidence. They didn't know if bicarbonate was helpful, totally useless, or maybe even harmful. So the BICAR-ICU study was designed to finally give them a clear answer, looking at 389 critically ill patients. Okay, so what did they find? The main thing they were looking for was the combination of death or ongoing organ failure. In the control group, 71% of patients had a bad outcome. In the bicarbonate group, it was 66%. So, a little better, but the difference wasn't statistically significant. That means it was probably just due to random chance. The big initial takeaway? Bicarbonate didn't seem to make a difference. But wait, that wasn't the whole story. You know, like in any good detective work, the researchers didn't just stop at that first answer. They dug deeper into the data, and hidden inside all those numbers was this fascinating little clue that pointed them in a totally new direction. And this is what they found. On the left, you see the overall survival. Again, no real difference. But look at the right. For a specific group of patients, the ones with severe acute kidney injury, or AKI, the story completely flipped. Their survival rate jumped from just 37% all the way up to 54% with bicarbonate. This was a huge hint that maybe, just maybe, the treatment did work, but only for this one specific group. Now, that clue about the kidney injury group was super exciting. But, and this is a big but in science, you can't build a whole new medical practice on a finding from one little subgroup. It could just be a fluke, a statistical ghost. To know for sure, they had to go back to the drawing board and design a new, bigger, more focused trial to prove it. And this quote, from an editorial in the journal JAMA, just nails the question everyone was asking. Was this a real breakthrough, or was it just a random, spurious finding? The scientific community needed a final, definitive answer. And that meant one thing: time for another, even more ambitious, trial. So here's how they did it. This table shows you how they leveled up from the first trial to the second, which they called BICARICU-2. You can see they went from studying all patients with acidemia to only the ones who also had that acute kidney injury. They also raised the stakes, looking at a tougher outcome, death from any cause at 90 days. And they beefed up the study with over 600 patients to get a more powerful result. All right, so after years of more research, hundreds more patients, dozens of hospitals, the big, definitive trial was finally done. The whole medical community was waiting. Was that clue real? Would bicarbonate finally prove to be a lifesaver for this one specific group of patients? What was the final verdict? The result was a shock. It was completely unambiguous. The treatment did not improve survival, not even a little. About 62% of patients in the bicarbonate group died by day 90, and it was pretty much the exact same in the control group. That promising clue from the first study, it just vanished when they put it under a bigger microscope. The hypothesis was wrong. So that's it then? Case closed? Is this decades-old treatment officially useless for these incredibly sick patients? Well, not so fast, because just like in the first trial, the headline result didn't tell the whole story. There was another twist. Buried in the secondary findings of that second trial
was this number, negative 15.5%. Now, on its own, it doesn't look like much, right? But what it represents is a hugely significant finding for both the patients and the hospitals. It's the absolute drop in the need for a really invasive life support therapy.
Check this out. In the control group, half of all patients, a full 50%, ended up needing kidney replacement therapy, which you probably know as dialysis. But in the bicarbonate group, only 35% did. So think about that. While bicarbonate didn't save more lives overall, it dramatically reduced the number of people who had to go on dialysis. And this is the real crucial takeaway. As that JAMA editorial concluded, the findings mean that bicarbonate can help patients potentially delay or avoid needing dialysis. It acts like a bridge, giving the body's own kidneys a fighting chance to recover without needing to be put on a machine. And that is a major benefit, even if it doesn't change the ultimate survival numbers. And this leaves us with a pretty fascinating question about how we view medical progress. We're always looking for that magic bullet, that one cure that dramatically saves lives. But the story of bicarbonate is way more nuanced than that. It's not a cure, but it turns out it is a very useful tool. It helps patients avoid a really invasive procedure and buys precious time for the body to try and heal itself. And in the world of critical care, you have to ask, isn't that a victory in its own right?